Hello. Okay, I believe we are live. So if you're joining us to chat Redworms tonight, a very, very warm welcome to you. And please do let us know where you're tuning in from in the chat. So if you watched our autumn webinar on parasite risk management, you'll know that there were loads of questions about redworm that we weren't able to cover. And so we promised you a deep dive to talk about them. And here we are. So I'm Claire Shand, Director and SQP at Westgate Labs. We're specialists in parasite control for horses and other grazing animals. And we were the first to offer the large redworm culturing to horse owners. And I'm joined tonight by one of the world's leading experts in equine parasitology, Professor Jackie Matthews from Austin Davis Biologics. So Jackie is the inventor of the small redworm blood test. And between us, we're going to talk all things small redworm tonight. So to cover the challenges that we face in protecting our horses from potential damage of infection from these worms, we're going to look at how the small redworm blood test works, when to use it, how it fits alongside worm egg counts to give a fuller risk picture, the resurgence of large redworm and how culturing supports detection, and then crucially, how resistance is influencing our treatment decisions. So we expect the presentations will take about 40 minutes. We're going to be doing a prize draw to win a 4Camp Plus pack. And to enter, all you do is just ask a question in the video chat on Facebook or comment worms, and then we'll enter you in, and we'll do that then after the main presentations are finished. And then do stay on if you can, as we're then going to go into a live Q&A to answer your questions about the large and small redworms. So before we get right into it, it would also be remiss of me not to mention that our early bird offer on our test kits ends at midnight tonight. So that's the 14th of January 2026 for anyone on the replay. So if you're watching live, you can head to our website after this to pick up your test kits for the year ahead, and there'll be all the details on how to do so there. But without further ado, I'm really pleased to welcome Jackie. Thank you so much for joining us. And this is a topic you're really passionate about, right?
Yeah, absolutely. I've been, living and breathing small redworm for 30 years now. So yeah, a long time.
Yeah, absolutely amazing. So we're just really grateful to be able to benefit from all your wisdom and insights from the coalface on that one. So perhaps you could start by giving us an introduction into these two parasites, some of their similarities and differences, and we've got some imagery to share as well, which is very lovely.
Okay, thanks, Claire. Excuse me. So we are covering small redworm and large redworm this evening. Now, these are actually two quite similar parasites in that they are historically related. They come from the same big sort of superfamily of worms, or nematodes as we call them, and they both belong to this group called the strongyles. Now, the similarities that they have is that they infect horses as specific hosts. They are nematodes, so they have male and female worms which mate, and the females release eggs which go in dung. And those stages that live in the environment on our paddocks, the egg stages in dung, the hatching of the first stage larvae, the second stage larvae, and the third stage larvae are all very similar between both small and large redworms. And then those third stage larvae are the stages that then can migrate out of the dung onto the paddock, go several feet, and it's those stages that can be infective to horses. Now, that's where the similarities end to a great degree, because once in the host, the large redworm has a more complex life cycle. It heads for the intestine, and there it burrows through the intestine and gets into the arteries that supply the gut. And these larvae then migrate up the arteries that supply the gut and undergo development in that particular site. And that's important. And Claire will come back to that, why it's important that there are these larval stages in this arterial site, which supplies blood to the gut. On the flip side, the small redworms, they go into the gut, but they only go into the wall, but they stay in the wall, and they have this period of development, which I'll show you in a minute. And then after a certain amount of time, they come back out. Now, in both cases with both worms, the larvae then make their way back to the tube or lumen of the gut, and they mature there, and they reach male and female worms, adult worms, which mate, and then the females produce eggs, and then we're back at the start of the life cycle. Now, historically, large redworms are super important parasites throughout the world because it is a disease-causing worm in horses. It causes colic and was very common in horse populations until the advent of the launch of particularly macrocyclic lactones. And these wormers are very effective against all stages of large red worm. And bizarrely, as far as we're aware, there doesn't seem to have been the development of drug resistance or wormer resistance in large red worm. So we've mostly suppressed the presence of that worm and the level of that worm in horses that are exposed to regular wormer treatments.
So, Jackie, that's our ivermectins and moxidectins, isn't it? When we say macrocyclic lactones, we're really talking about those two chemicals. Yeah.
So, and the flip side, the small red worm sort of emerged as an important parasite of horses, really in the sort of psyche of parasitologists and equine vets and horse owners in the 80s, when first of all we realised that these parasites were very good at acquiring and developing resistance to wormers, particularly initially to fenbendazole, and then subsequently to pyrantel salts, and now there's evidence of resistance to ivermectin and moxidectin. So that's the important parasite in which resistance develops. So we've got to kind of balance up the need to treat for these worms without over-treating to select for drug resistance. The other thing that was identified really about larval cyathostominosis, it was a disease that cyathostomins or small red worms caused. And that, which I'll show you in a minute, is due to the build-up of these gut wall stages of small red worm. And that became a very recognised clinical syndrome around the period when I was at vet school in the 80s. We were very much taught that the emerging parasite in horses is small red worm, and we should forget about large red worm because it's very susceptible to these, particularly ivermectin and moxidectin. But we know that's not really the case. As we've changed practices and moved forward over the last 30 or 40 years, we really need to think about how we control both of these parasites sustainably.
Fantastic. Thanks, Jackie. And yet, well, no introduction to parasite control would be complete these days without us looking at a horse's parasite risk assessment result, because it's really the basis for how we decide how we're going to move forward with any horse in terms of their management, their testing and their treatment regimes that they're going to need. So this is the first of our polls that we ran on our Facebook pages in the last week or so, and that was encouraging people to go to What's Your Worm Risk, and Jackie was instrumental in the development of this really fantastic tool for horse owners. And we asked you to complete that, and we can see a really good breakdown there that nearly 60% of horses this was completed for were around the 60% mark. We had 25% in the medium and then high there as well. So, but what this is actually bucking a trend, isn't it? Because what we see in the bigger population is that there are more medium and high risk horses than there actually are low. And it's not a scourge on horse owners. It just is all of the different factors, the parameters that make up risk and the for horses, and they're just weighted to be able to give us the information that we need for it. And we did do a webinar all about risk in the autumn, so we can put a link to that if you want more information. But Jackie, do you want to say something quickly about this and how it looks in terms of the results that you have from the bigger data set?
Yeah, thanks, Claire. So this looks great. I mean, usually, so I think we've assessed over 2,000 responses in What's Your Worm Risk, which you can access at whatsyourwormrisk.com. And we developed that to support people that own horses and just trying to get to grips with what risk means and what are the factors associated with increasing or decreasing a horse's risk. And I think we see this flip to low risk probably because I think the engagement of people on this webinar and with your Facebook feed are probably Westgate or even Austin Davis or Equisal customers, and they understand sustainable control and they understand the importance of management and diagnostic testing, and I think that just reflects the sort of the knowledge base of the people that have completed the poll. I think that's probably quite biased to be against people that have already kind of a good idea about how to control worms sustainably.
Yeah, we're speaking to the converted, but it's great to have you all here, so thank you.
Absolutely. There's always something to learn. I'm still learning stuff about worms, so.
Oh, aren't we all? Yeah, definitely. And then the other question that we asked was about blood testing or treating for encysted redworm this year, which again was really interesting. Around 81.5% of you were treating, so that's with a larvicidal treatment that gets those encysted small redworm. at 13.7% did the blood test, which is fantastic. And then another proportion of you, 4.8, are doing nothing, and which I'm sure you have done your research, your risk assessment, and looked at all of your worm egg count results, enabled to do that. So we're going to go on and look at then the different discussion points around how we decide what we're doing at this time of year for our entisted redworm. So off you go, Jackie. You can get into the nitty-gritty of it all.
Yeah, nitty-gritty time. So as I've already mentioned, small redworm larvae encyst in the gut wall, and they can remain in that place for many months. In fact, some studies done many years ago showed that with horses that were untreated and had no subsequent infections, the worms lasted over 2 years. So they can get in there and they can hang around for a long time. Particularly in the UK, we tend to find higher numbers of these larvae from the late summer onwards, and that's due to the fact that horses graze paddocks, and if they're contaminated, they will accumulate these worms over time from the contaminated grazing. And then what we think happens is the horse develops a sort of immune response to those parasites and slows them in their development. So they're just accumulating this bigger and bigger mass of worms if they continue to be exposed to contaminated grazing. What we find is that animals do develop an immunity to a certain level over time and tend to control the worm burdens better as they get older. But younger animals under 5 years of age tend to be more susceptible and tend to be more sensitive to accumulating these large burdens. We also find with older horses, particularly those with PPID, who have perhaps suppressed immune response because of the PPID condition, they can also accumulate these heavier burdens. And of course, the main risk factor is if you're grazing wormy paddocks, then you will become infected. The larvae are a concern because, as I mentioned earlier, when they accumulate in large numbers, there's some trigger happens where they can all reactivate at the same time. And that is a condition called larval cyathisdominosis. And that is associated with weight loss, diarrhea, and or colic in cases. And unfortunately, studies have shown that 50% of these cases that develop with this severe syndrome are actually fatal. So it's really important that we avoid these accumulations of worms. And you can just see like every dot at the top of picture here, every tiny dot looks like a little blackhead, doesn't it? That's a bit of a horse's gut that had been obtained at an abattoir and had been photographed. And when we counted that horse's worms, when we made estimates based on enumerating the larvae and the adults, it had over 3 million worms. So you can see that you can really accumulate in massive numbers. And the horse below is sadly a case that has developed disease. So it's important that we manage the risk of the accumulation of these large numbers of parasites within the gut wall. And the main way to do that is to improve paddock hygiene, because if we break the life cycle of this parasite and we remove those larvae from the paddock, then the horses can't accumulate. It's important as well when we're thinking about managing the risk of this disease is then don't think, oh, I'm really scared of a horse getting larval cyathisdominosis, I'm just going to treat it with an anthelmintic, because that's a non-sustainable practice. Because what we know now is that small redworms, as I mentioned already, are really quite adept at developing drug resistance. And therefore, if we just keep treating all horses all the time with moxidectin in particular, which is one of the 2 licensed compounds for treating these stages, then we will select for resistance. And that means that when animals do get really sick, susceptible animals are sick, and if the wormers don't work, then we are at risk of not being able to do our best to save them, because we don't have an effective tool to kill the worms. So that means on the flip side, particularly in well-managed horses, we don't have to give them a wormer, and we can do a risk assessment to inform that lack of need not to worm, and that can also be supported by the use of diagnostic testing, which I'll now go on to talk about. Next slide. Now, this is just a little infographic just to show you really what I was talking about there. So this is the infective L3 comes in, and then the small redworm develops through these various stages in the gut wall. And these are only really susceptible to moxidectin as a single dose, and in drug-sensitive population to 5 days of fenbendazole. And we use those drugs as tools to kill larvae in order to reduce the burden and to reduce the risk of disease. Sadly, there's a very widespread resistance to fenbendazole. So unless you know the effectiveness of that particular compound in that group of horses, then we wouldn't recommend its use against small redworm larvae. What is important to remember is we can look at eggs and dung. Obviously, that's a fantastic tool for looking at what a horse is putting out and what it's contaminating paddocks with, and an excellent tool to use throughout the year to reduce shedding, to reduce contamination. But egg counts do not tell us anything about the number of larval stages within the gut wall. In fact, oftentimes, horses with high burdens of larvae will have suspiciously low egg counts because most of the stages are actually an immature stage that don't release eggs. So I did mention there about worming and selection for worming, for wormer resistance, and how we need to avoid that. But what we're finding, even though people like myself have been going on for 20, 30 years about drug resistance, we still find a lot of people still reach for wormer when there's not really the need to worm, particularly with the larvicidal treatment for small red worm in the autumn, because I think for so many years we banged on about using that drug to reduce the risk of disease. And what we want people to do is to step back now and take an evidence-based approach to treatment and to overcome their fears of not worming and to overcome those decades of advice previously that promoted blanket treatments in all horses, the early 2000s, and then subsequent years of advice about giving horses all group treatments. We really need to change our perception around what we do at this time of year, well, from autumn onwards, late autumn onwards. We've got to let people understand that it's going to be worth the hassle and it's going to be worth the cost of using diagnostic-led programs in order to address both the horses that are at risk of clinical disease and to address reducing selection for resistance. And to try and fill those knowledge gaps so that people become more confident in making the right treatment choice for larval stages of small red worm. So this brings us to the small red worm blood test. This was a test that I started initially developing when I worked at Liverpool many years ago by doing some basic research to understand immune responses to small red worm in horses. And from that, we did molecular studies to develop the test where we actually cloned and produced these recombinant or synthetic antigens from small red worm, and we use them in a test called an ELISA test. And in that ELISA test is what we do is we measure specific antibodies of a horse to small red worm, both mucosal stages and the gut tube, the luminal stages. And then we provide a quantification of that antibody level. And because we've done research to show that the level of antibody correlates with a certain level of worm burden, we're able to infer the worm burden level of that individual horse so that we can provide advice about whether or not it needs treated. Now, because the test works at a relatively small worm burden, which is 10,000 worms, that's where it works really well in giving information about the level of burden, we advise that it should be used in horses at low risk of small red worm infection. And that low risk of obviously can be ascertained by undertaking a risk assessment. Next slide. So we, in part, because of this sort of ability to understand what to do in autumn, but all year for people to understand what to do about tapeworm, how to have informed decisions with their prescribers, we, Austin Davis, developed whatsyourwormrisk.com, and that asks specific questions about your horse, its age, its grazing group, how you manage that horse's grazing, and the recent test results, not just of that horse itself, but the horses that it grazes with, because the horses that it grazes with will impact that horse's risk because they share a paddock. Now, once you've done a risk assessment, either with your prescriber or using something like What's Your Worm Risk, you can then make the decision about what to do about small red worm in sort of late autumn onwards. Now, horses at higher risk, we should be thinking about giving them a larvicidal treatment earlier because we know they're at a higher risk of disease, but we also want to try and kill those worms before they mature and then contaminate paddocks if the horses are out wintering. So any horse that you assess as high risk, particularly very high risk, from late autumn onwards, then that would benefit from a larvicidal treatment with moxidectin. And don't forget, you can use egg counts at this time of year to assess the effectiveness of that treatment if you have a positive egg count at treatment, and then you can look at it 2 weeks later to see if the drug has actually worked in reducing egg counts. Then on the flip side, if your horse comes out as low risk on your calculator or through your discussion, you can make several choices. If you have a very informed knowledge of management and you know that horse is super low risk because it either doesn't leave its paddock or it's standing in a box all the time, and you've got fecal egg count data going back maybe 1 or 2 years, which are negative, well, you could leave that horse and just say, well, I won't treat it because I know it's a super low risk and I don't think it needs tested because I know it's had not access to worms to build up a mucosal worm burden. However, especially if there's some uncertainty around some of the risk factors for a worm infection, or you are someone that has a horse that's low risk, and we come across this all the time, but you think, I'm just going to treat just in case, you're a just in case person, well, that's a really good time to apply the small red worm test. And the small red worm test will then either confirm that your horse is at low risk of small red worm because it's a very low serum score, a low antibody level, which is measured in the test, and then you don't have to treat that horse, and low risk is confirmed. However, occasionally what you might find is a horse that you've assigned as low risk, or a horse that you don't really know about all the risk factors, but you think it might be low risk, you find that horse will become above the serum score thresholds that we recommend for treatment, and then you would need to apply a treatment to that horse. But importantly, particularly if it's in a group, you need to think what management things happened in that horse that made it have a higher burden than I thought it would have, or than its co-grazing population. And then you can maybe adapt that management into the next year. Next slide. So these are the sort of questions you need to ask yourself or in discussion with your vet when making a decision about whether or not to use a small red worm test. And all this information is on the Austin Davis website under the guidelines for the test. But it really just boils down to this table. So a low infection risk would be, for example, one or more, all or most of the following: a closed herd, dung removed at least 2 times a week, a low stocking density, no young stock, and in an adult horse or a horse with limited grazing time. That would be the perfect sort of candidate for doing the small red worm blood test, particularly if that horse had very low egg counts in that year and the preceding year. And then for those horses that would come out at moderate or high infection risk, when you look at those questions, then we would still recommend that you give it a larvicidal treatment. What does it look like? So some of you I noticed from Facebook, thanks everybody, and well done to you for using the small red worm blood test already. But for those of you that haven't seen how the results are output, this is just a typical example of the types of test results we get. So what I've done here is I've copied our results email. So this is all the information that your vet would get back about your horse's serum score. And then your horse would be listed along with the date it was tested and then its serum score. And I've actually taken serum scores from yesterday. So these are all anonymized. So I'll give them different names, as you can see. Claudia Frinkelman, for example, and Boris St. John. No prizes for guessing.
Very good.
For those ones. But I've actually taken these are real scores from a group of 4 horses that we tested at Austin Davis on... It must have been Monday because we're on Wednesday now. And you can see these all have low levels of antibody, because if you look at the table, you can see that horses that have less than 1,000 worms have a serum score of under 14.37. So you can see Kira Stammer here. She's got a very low level of antibody. And then horses with a serum score of under 15.61 are likely to have a worm burden of less than 5,000, which is still very low. And you can see that Boris had that. And then you have horses that lie intermediate. I couldn't believe these were great results because it allowed us to talk about all the different levels. And then you can see that Winston Churchman had a score in between. So these 3 horses had a small red worm burden likely to be under 10,000. And because these horses are in a low risk population, if we make this up about them, there's a closed herd and there's dung removal twice a week, and there is a good low stocking density, and all adult horses, I would advise that vet to then take the top threshold of 10,000 worms for treatment. So the only horse that would require treatment would be Claudia, and then she would then receive a treatment, and then you would have to think about what's going on with Claudia and why was her serum score high. It wasn't particularly high, she's just above the 10,000 threshold. So actually patting the back to that person who actually supplied the blood samples for those horses. They're doing a good job.
Yeah, really interesting. Thanks, Jackie.
Yep, and so here's, I'm just going to talk now about some horses in low risk settings and the type of results we see. So Corinne Austin's the director at Austin Davis. These are her horse results, and she's been using the small red worm blood test since they commercialized the test back in 2019. So she's had 2 to 3 horses over that time. On they're out at grass. One of them doesn't graze much because he's He's a little fat pony. But anyway, they're all out all the time, and they are from their paddocks where they're kept. The dung is removed twice a day throughout the year, so they're very low risk. But despite that, Corin has decided to blood test them twice a year just to see if there is a change in the risk. And this is partly for two reasons. First of all, she introduced another horse quite soon after she started testing, and also because there's a bridleway quite nearby, so there could be a risk of contamination. But you can see these 3 horses, and then subsequently 2 horses, have never come anywhere near the 10,000 small redworm burden cut-off, and therefore they haven't received any anthelmintics now since 2018, because they're also tapeworm tested. The next slide.
Amazing.
I know. And here's another low-risk group, and this is like looking at a bigger cohort. So we get samples in from a sport horse clinic in the EU, and they allowed us to analyse their data for 2 years, and we looked at the 981 horses that were from which samples were sent. Now, these are sport horses. We don't really know anything about their history except they're from a sport horse clinic, but we made the assumption that would be of relatively low risk. And what we found is when we looked at their data, we found that I was actually amazed at this. Over 62% were actually below the 1,000 threshold for small redworm. That's low, very low burdens, negligible burdens, so they wouldn't require treatment. And then a further 20% were then below the 10,000 threshold. So if the vet there that was on site decided there's a low risk situation, then they could use the 10,000 threshold. So in this case, we only actually found out of all these horses that were tested, and some of them had different sorts of backgrounds, they travelled, and obviously some might have had access to paddocks, that only 20% of them were above the 10,000 threshold. So that's a massive saving in anthelmintic compared to when probably these horses would have been treated regularly and every year.
Yeah, huge reduction.
Oh, no. And this is just very recent work. This is brand new hot data that we've been doing in a project with Tim Mayer at Bell Equine, in part of CVS down in Kent. And we're looking at different yards with different risk levels, and because we want to look at how the tests perform and what can that tell us in these different risk situations. So we've got high risk yards that are open with no dung removal and harrowing, for example, and some young horses there. And then we've got a mixed risk yard where they do different types of management. One group are subjected to dung removal and the other to harrowing. And then we've got a low risk group, and that low risk group are on sort of it's a DIY livery yard, and the horses are on individual paddocks from which the dung is moved variably depending on the owner who's managing them. And what we found, as we would have predicted, in a low risk situation, you get much more horses below your thresholds for treatment. For fecal egg counts, for example, almost 90% below in a summer egg count on the low risk yard, compared to only under 40% below this threshold in the high risk. And we see similar results with the small redworm test as well. So even on that low risk yard, the lady that owned the yard used to make all her owners treat her horses with moxidectin every autumn as a just in case. And now in the first year, she's been able to reduce the treatments of moxidectin by over 60% by doing the test. So that's been really worthwhile. And we even saw an association in the mixed risk yard that many more horses didn't require treatment when they were on less risky paddocks where dung was removed.
Fantastic.
Now, finally, I'd like to just say something about what the test can't be used for, because I think it's important for people to understand that. So just going through the points in the slide, first of all, we don't recommend that the test is used to predict the risk of disease of larval cyathostominosis. And that's because the condition itself is very complex and depends on both the horse's response to infection as well as its overall burden. So there's a complex relationship there between the immune response and the burden. And we can't really say from any of the work that's been published so far what level of burden a horse needs to have in order to develop disease. The test detects the small redworms thresholds that are used in the test are only up to 10,000 worms, and that's a relatively low number of worms in terms of clinical disease for small redworm. So you have a worm burden above 10,000, that doesn't mean that the horse is definitely going to have larval cyathostominosis. So the risk of a disease should be assessed by your vet by looking at the horse signalement, its management, its test history, and as you can see below, not to just use the test as a diagnostic in a clinical case, but should also be subjected to other types of tests. Particularly important are looking for larvae in dung in a suspect case and a low protein level in the blood in horses with severe disease. What we can say, though, and some vets have used this, particularly as a vet in Ireland that works with us quite a lot, is you can use the test as a vet in practice at her level to check if managements are improving. So we've had a clinical outbreak of disease, for example. The vet has given advice about improving management, reducing transmission, better paddock hygiene, and then the test could be used further down the line to see if the serum scores are going down, to see if those effects of management are actually working. And importantly, because it's a very sensitive test for small redworm, it can be used, and it is used by vets to rule out small redworms in the cause of different types of gut disease, such as colitis or diarrhea, which are not due to parasites, and colic. It does, as I said earlier, it doesn't just measure encysted larvae only, it's designed to measure all host stages. So that's important to remember. And it can't be used for checking worm effectiveness because the antibodies take a while to drop after treatment. So that would take too long in order to assess whether or not that wormer is working. So you should do a fecal egg count reduction test in order to check wormer effectiveness.
Fantastic.
So just finally, in conclusion, just as a summary, because I've trotted through this very fast, is a small redworm blood test supports vets and owners in making informed decisions relating to treatments for encysted larvae. The test is recommended, therefore, for use in horses at low risk of small redworm infection to help reduce unnecessary worming in autumn and winter when we'd normally be applying a larvicidal treatment. Because owners still give blanket treatments out of fear of disease, it's important, even if they're assessed as low risk, to consider not giving those treatments as a just in case, which we'll talk about in a minute. And the test can then be used to provide confidence in withholding that treatment. And what we found from our own research and work done by others is that using the test in low-risk groups can significantly reduce unnecessary wormer use. And we find if used appropriately in a low-risk group, you can actually reduce worming by over 80 to over 90%, comparing it to a blanket treatment approach. And like all parasite monitoring tools, whether it's egg counts, whether it's tapeworm antibody tests, or whether it's small redworm antibody tests, it's a really good tool for vets and owners to look at how well the parasite control is working, because it gives a monitor of the level of exposure. Okay, so we're just going to discuss, Claire and I have had a lot of discussion about this previously and recently, and what are the consequences of doing the different things when it comes to the point of deciding whether or not a horse needs treatment, particularly if it's assessed as low risk.
Yeah, I think that's absolutely key, isn't it? Because it's that confidence, because the larval cythostominosis is such severe disease, and it has that just more than 50% of cases are fatal. It's not something that you want to risk for your individual horse, but we've also got this much bigger problem of resistance. So it's really like balancing those two things. And I think this is where this comes in, isn't it? With weighing up all of these factors that go into that.
Absolutely, yeah. And this, I mean, so Claire and I discussed this morning. She's got this brilliant infographic, so I'm going to be using this all the time in the low risk situation. So what are our options in a low risk case? So in a just in case thing. So if you're one of these people, oh, my horse is definitely low risk, but I'm just going to give it a wormering just in case. What are the consequences of that? What are the sequelae of giving that in a low risk, that treatment in a low risk group? Well, first of all, you will increase the probability of anthelmintic resistance, because you're just treating everybody that doesn't need treated, and you're exposing all the worms in those horses, whether it's a large burden or a small burden, to the chemical. And when you expose them to the chemical, you kill some worms that are more sensitive, and you select for those that are less sensitive to the drug. So what could happen is that you end up having a high proportion of horses receiving a treatment they don't need, but at the same time, you're increasing the probability of anthelmintic resistance. Now, on the flip side, there's the absolutely do nothing cases where people don't test or they don't treat. Now, if the risk assessment is done properly and you've ruled out every single risk factor that could lead to transmission and infection, and you've got, for example, evidence of low egg counts over several tests at least, then you could have a do nothing approach and just don't treat or don't test. However, there is a possibility that you might miss some horses that have accrued a burden for whatever reason. So in this case, in a do nothing scenario, there is a low proportion of horses that might benefit from treatment, but you've missed them because you decided not to test or to treat. And that slightly increases the probability that you might get clinical disease compared to either treating just in case or in the middle, applying the test to understand the level of burden and whether or not that horse requires a treatment based on its antibody response that you've measured in the test. So that's the sort of balance that you need to think about and discuss with your vet, or SQPs discuss with your customers to talk to their vet about really what they should be doing around probably late autumn through winter in regards to small red worm larval treatments.
Yeah, because it is a veterinary test, but absolutely any of your prescribers could talk you through your program, your plan, your risk assessment for your horses, and decide if that's something that you want to employ. And then you can talk to your vet about coming out to take the blood test and then building that into your parasite control program. So really valuable. It's this whole just knowledge is power thing, isn't it, really? So for our final poll that we're presenting this evening, this is looking at different risk factors. So does your horse fit into any of these particular groups? So we asked you about being a broodmare or a youngster. We know that they are higher risk of parasite infection just because young horses are wormy. We're talking about livery, so more than 30 horses. The more horses that are kept together, just the more important parasite control becomes. Or are they regularly competing away? So where they may be picking up parasite infection from elsewhere. So they're the kind of higher risk horses that we would associate with going out and picking up infection. But on the flip side, we're also talking about whether horses have had no wormers for more than 12 months. And about 40% of horses that we surveyed are in this category. And the reason that we're asking this is because these are all different factors for the predisposition to a large strong-gale infection. So that's why we're interested, and that's what we're going to go on and talk about now, because as Jackie alluded to, there is, can we call it a cousin, the large redworm of the small redworm? But this is not a history lesson. So we talked about how in the past, this interval worming that we were doing through the late 20th century, all but eradicated these large redworm. And we didn't really have to think about it, but unfortunately, this is not a history lesson. We are having this resurgence concern that's just being highlighted to us here in the UK. And one of the biggest problems is that until recently, we had no way of monitoring this either. So really, this could be happening blind in the UK. So we wanted to do something about that. And as already Jackie has said, it's a really, really pathogenic parasite, the large redworm. The larvae are the most dangerous, and they're migrating through blood vessels and feeding as they go on these tissues. They've got a very long life cycle, so it can take quite a little while for them to become egg laying and for the mature worms to go back to the gut and then to produce eggs that we can monitor. But while the larvae are in and around the organs of the horse's body, they have serious clinical threat to our horses. So that can present as just kind of vague peritonitis, horses just not thriving well, and that's because of arterial damage and blood loss and things like that. But we've also got weight loss and lethargy, but we've also got these much more serious conditions, like because they are munching through artery walls, that can cut off blood supply to intestines, and it can cause things like hemorrhage and sudden death, and which very, very traumatic. And that usually happens when a horse is under stress. So we're looking at broodmares and competition horses particularly being affected by it. So this is something that we don't want to pass us by, and we need to know what to do about it. And there's just an image there of an aneurysm in a mesenteric artery that was caused by a large redworm infection. Not nice at all. So that this is being highlighted in several different places. So I've just got some quotes here from some of our research papers that are recent, and also from the Horse Race Levy Board, about this being a significant concern, this potential re-emergence of the large strong-gale. We've seen it ourselves back in 2023. We were sent a photo of a large redworm in a horse's dropping from a livery yard in the UK, and that really piqued our interest because we don't get them in the UK. What's going on? It's never been on the menu. And this is not an isolated incident. Through Canter, Contentors and other vet channels, there's just this renewed attention. So field observations, fatalities, increasing concern in literature and professional guidance. And that's particularly in breeding and young stock contexts. People are starting to talk about this parasite again. And we've got a case study here from Sweden, which is really, really interesting. So in Sweden, the sale of wormers for animal use has been restricted to prescription only since October 2007. And that's a directive that was significantly reduced the overall sale and use of wormers, which overall is a good thing. The legal change aims to promote this selective therapy that we've already talked about, where treatments are based on the worm egg counts rather than routine worming, because they're so heightened to the resistance problems. And there are two real what they've really found then is that in the Swedish study, that when they measured livery yards back in 2008, there was a prevalence of less than 6% of horses infected with large strongyle. And when they went back in 2015 and measured that, that was up to 53%. So it's a really big jump in that time. And we're not saying that this is what's going to happen in the UK as we shift towards this more selective therapy, but it's a potential, and that's what we've just got to be aware of. And it's driven really by two things. So this move definitely to more targeted worming protocols, which is a good thing. We've already talked about the importance of that. We don't have the draconian measures of Sweden, but the need is there, and it's advocated by Cantor, the Beaver Project worms, and many other parasitologists as well, to get to this more selective treatment. But that does open the door. And then the second reason is this increased horse movement. So horses coming in with infection that are going to shed eggs and infect our horses. There's a higher prevalence of large strongyle in other parts of the world, particularly Europe, Australasia, places like that, where they haven't done the routine worming that we have through the 60s and 70s. And we have to start thinking about parasites as transmissible disease and making sure that we do our quarantine and we test horses that might have been exposed potentially to large strongyle. And then again, we go back to this limitation of our tests, because that's really all we're doing when we're looking at putting together our programs is what are the limitations as well as the benefits of the tests that we're employing. And so how do we do that to get the most complete picture as possible? And one of the biggest problems is that worm egg counts don't differentiate between the small and large strongyle eggs. So they look exactly the same under the microscope. And we've currently relied on the fact that 99.9% of strongyles identified in worm egg counts are small redworm, and the treatment is the same. But while we're going to only target medium to high egg shedders of small redworm and then leave the counts of under 200 eggs per gram untreated, we would want to treat any presence of large redworm that are detected. So we've got this balance here now that's starting to shift with this risk of rising resistance, but also then this need to identify and treat any of our large redworm that might be present. And then, so this is how we came about developing we didn't develop the test, but we developed the ability to offer it in our lab, which is a large strongyle larval culture. So what we're doing is we're taking a fecal sample, we're incubating it. This is Emily here in our lab, and putting this into what is not a drinks fridge, but actually a small little incubator on the lab bench here, which is the ideal conditions in order to hatch any of the worm eggs that are there, so that they can then be extracted and identified under the microscope. And then when they're at larval stage, we can differentiate there between the large and small strongyle. And then it's something that's cost effective for routine monitoring, but it is fairly time consuming. So it takes about 10 to 14 days to do. And then we need some skilled personnel to accurately identify the larvae. And that's all species of large redworm. So we'd tell you whether that was, there were 3 different main types of large redworm there, the Strongylus vulgaris, but also Equinus and Edentatus as well. But each dangerous and useful to know what's there. The Strongylus vulgaris, the most dangerous though, and most common, we think, although luckily it's not a big problem so far in the UK, but we really want to test more samples. There's also a PCR that we can do as well. That's not available in the UK as far as I know just now, and that is a way of then again extracting the eggs, but then using genetic sampling in order to differentiate between the different species to give a result. And larval culture is something that the Cantor guidelines mention when well performed. It has a sensitivity and specificity, which are in the sort of 73, 84% respectively. So really it's all about how much dung do we sample in order to get a representative enough result that says you don't have large strong gal, because obviously there is a potential that you're not going to pick up every egg from doing a sample test. So we take our process from literature, and in order to get a representative enough sample, which gives confidence to do this as a screening. And that's what we're really going to go on and talk about, is how to build this into a parasite control program to enable us to detect these parasites as they come up and to be able to deal with them. So we have a larval testing service, and you can get that directly from us. And we're needing a slightly more dung, but it's actually the same process as taking a worm egg count sample and sending it off to the lab with us. And we're suggesting, first off, that those higher risk horses that we identified in that poll, the studs and breeding operations were with young stock, our competition and sales yards, the stocking density being high, are all things that might highlight that a horse may be more susceptible to getting the low strong gal. But also on the flip side, these horses on minimal or selective worming schedules. So those are the kind of risk factors, but it doesn't mean to say that any horse couldn't be infected. And it is something that we're wanting to encourage people to begin to build into your programs, so we can start looking for the needles in the haystacks, you know what I mean? And in looking at the literature and in doing this review, we're going to be publishing on this in the next few weeks, but we've been analysing the different ways and implications with our large redworm control. So we've got on the basis there, the base of that, the regular worming, which has, as we've already discussed, this high risk of resistance emerging. But because we are treating and there's no susceptibility or no resistance, we think that so far to large redworm, that there's low risk of large redworm for doing that. We could move to worm egg counts only, which we know is fantastic for decreasing risk of resistance and targeting our treatment. However, there is a potential of leaving the door open there with an increased risk of large redworm. The way to mitigate that completely, or as much as we can, belt and braces, is to do our worm egg count and then to add a larval culture in to do that annually. And you can do that on individual horses, or we can also test cohorts of 4 grazing together. So we can do, it's not something that's usual to do for our horses. We tend to test them as individuals, but in order to screen, if you've got 4 horses that are grazing together, then we can do that, and helps to bring the cost down and just get a test in at least, which is what we've got to begin to do with the large strong giles. And then timing wise, again, the research is showing that there's little seasonal variation. So building that in wherever you can in your program is, just to make it as easy as possible for you is great. If you've got foals that have been out grazing, there's potential that they could have picked those up over the spring, summer months. So the recommendation there is at 7 to 9 months, that might be a good time to get a test in. And we just know that the youngsters are so much more susceptible to parasite infection, so it would catch that if you need to do so. And then if you've had a horse that's travelled or come in contact with others from areas where it might be present, 7 months after that exposure. So remember, we've got to let life cycle complete and those eggs to be shedding, then we can do the test on that and hopefully define whether they're a large strong gal there or not, and whether the horse has come into contact with it. So just, that rounds kind of up the main differences between small and large redworm and how we're going to test for those. And this is really what that looks like in terms of targeted worm control for our healthy adults. So we would probably test more frequently if they were younger or sort of higher risk horses. But generally, we're looking at doing something every season. So getting our worm egg counts in there, spring, summer, autumn. In our autumn, winter, then looking at blood testing and potentially treating for possible encysted redworm. We've got our tapeworm there, doing our equisal every 6 months, and that's either spring, autumn, or summer, winter, depending on what fits in. Adding in that annual screening for large strong gal with a culture, fantastic thing to do. And then again, reduction testing is the other piece of the puzzle there. So if you do need to treat, then doing a reduction test after that to monitor for any wormer resistance that might be present. And that really is a fantastic way of using the tests with your horses to give you as much information as possible and to minimize the chemical use on those ones. So yeah, screening is our best defense. I know it's really tempting to reach for broad spectrum wormers just in case. And we hear about the large strong gal possible resurgence and the danger and the damage that that could do. And yes, maybe we do want to give a wormer for that again, at least every year, but we're asking you to just not do the knee-jerk reaction thing and look at this proportionately, really. This risk assessment is using our tests, treating only when we really need to protect this efficacy for all of our parasites, and looking at these new tools and using them wisely. So really that's my call to action, is to really think about how we're doing this, what we're employing, and looking at the costs of not doing so. So, this rise of resistance, and then it's really protecting our horses now and in the future from disease. So that's where we're at. So I think that's our formal bit, isn't it, Jackie? Have you got anything else to add to that?
Oh, that's absolutely great. Completely support what you say about large redworm. I think it's just one of these things we really have to start keeping our eye on, and also from the scientists among us that are getting the information from other studies that are outside the UK where they've been doing more evidence-based treatments for longer, and following what's going on there to inform the type of advice that we give in the UK.
Yeah, fantastic. Okay, so as we wrap that one up, I think the next thing, here we go, is our prize draw. So well done to all of you who've stayed on the call and stuck with us. So I think we'll be able to, Katrina's been in the background busily collating all the names of people who have asked questions and commented worms, and we can have a little bit of a drum roll. And then look and announce that one. So I'll just do that. Hey, fantastic. Okay, the winner is Nicole Nixon. So congratulations, Nicole. You win one of our 4 Count Plus season packs. So that's got 4 worm egg counts for your year ahead and 2 Equicell tapeworm tests in it as well. So you can go and use those with your horses and only treat if you need to. So fantastic. So I think we're going to go into our Q&A now, and we can cover off all the things that questions that were raised, because I know I can see a lot of those coming through in the chat. So I'll put this back now to side by side. Here we go. Right,
cool.
Let's go from the top. Okay. Oh gosh, so many questions. This is brilliant.
I've answered quite a few. So,
have you in the text?
Yeah, on Facebook I've gone through ones that are relevant. There's some that I think maybe need a bit more detailed discussion. There's one from it's actually on our studio chat there. It's from Marianne Sturgeon. And I think she's been misinformed about the test. So hello, Marianne. I hope you're still here so we can answer you. So she said that she came in late, so she didn't hear the start of the talk, but she said that when she did the blood test for encysted redworm, they said, I don't know who they is, that it shows what the situation was around 4 months ago, so it's not accurate to be used as an exact yes or no to worming. Is that correct? No, that's wrong. That's a simple answer. So what we recommend, and I think whoever's giving you this advice, Marianne, is got mixed up about the guidelines and what we say. So if you've got a horse in a given time and it hasn't had a recent treatment, and we say at least 4 months since its last treatment, then at that given time, when you take the blood sample, the antibodies that we measure in the test will reflect the antibody response to that horse, to the worms at the time of testing. Then obviously the antibodies will be measured to give a serum score, and that serum score will then be relayed back to you via your vet with advice about whether or not to treat. And that serum score reflects the antibody level to the worms at the time of testing. Now, If you then go ahead and say you had a serum score of 46, for example, and you were advised to treat with moxidectin, then you give a treatment. And what happens at the time of treatment, hopefully, most, if not, well, most of the worms, I wouldn't say all of the worms, but most of the worms will be killed by the wormer. And those worms then are destroyed by the wormer. But the antibodies that are circulating at the time of treatment, they take a while to go down. It's those antibodies at the time of treatment take a while to go down. And we've made a conservative judgment on work that's been done on antibodies in horses and with tapeworm studies as well. What we've said is, well, actually, we would ask for you to wait at least 4 months if you're going to blood test a horse again for small red worm, because actually, if you test before that time, what you will be looking at are the antibodies that might have been present at the time when the horse was treated. So what you've been told is completely inaccurate. So if the horse has not received a treatment in the last 4 months, that blood test will reflect the antibody levels to the worms present in that individual. The important thing is to not test too soon again. And we would recommend you wait at least 4 months. It's the same for tapeworm blood test. For a tapeworm saliva test, actually, you can test quicker post-treatment from 3 months onwards, because antibodies are lost in saliva quicker through the saliva test. So it's important to understand that degeneration of antibody after treatment and not to mix that up with whatever you've been told here. I hope that makes sense.
Fab. And we've got Karen asking, any idea regarding contaminated pasture? I allowed someone at my yard to use part of my field for a few months. The horse isn't wormed or tested, so its status is unknown, and I'm reluctant to use that area of my field. Yeah, I can totally see why you would be, really, because you just don't know, do you? I guess it's resting it, really. 6 months if you can, up to a year. Definitely you're right to fence that off, and then you can start using it again probably after that time. It's all to do with your grazing pressure, I would say.
Yeah, I think as well. And I think that horse would probably benefit from monitoring. If you're not, I'm assuming you're already monitoring your horse. So what we find particularly with tapeworm, and it can be a real pain. So there could be the situation, I don't know if dung was removed. If the dung wasn't removed from where that horse was grazed as part of your field, then there could be tapeworm eggs if that horse hadn't been tested and its infection status was unknown. And then these little arrebitid mites, there's thousands of them in paddocks everywhere. We can't avoid them. They're all part of the ecosystem. The arrebitid mite acts as the intermediate host of tapeworm, and it goes into the poo and it eats tapeworm eggs. And then within that arrebitid mite, the tapeworm larva develops, and that takes about 2 months. And then those arrebitid mites can move around. So there is a possibility, actually, that your horse, if it wasn't infected with tapeworm and the horse that was on the paddock was infected with tapeworm, the arrebitid mites then could migrate away from there and infect your horse. The same could be said with larvae from the eggs that hatch from small redworm or even large redworm, for example. So your horse is more at risk than it was because you've got this unknown situation. So I'd probably recommend, if you haven't tested recently, to go ahead now and test your horse. Now, if she or he is low risk, you could test for tapeworm, and just to make sure he or she has stayed in a low category if she's been low before, and you could either apply the small redworm test or you could do an egg count under the caveat that they've either your horse hasn't been treated for egg counts in the last, I would say, 2 to 3 months, and for a blood test for at least 4 months.
Brilliant. Thanks, Jackie. We've been told there's a few comments from people saying that they're struggling to get hold of Equest Pramox, and we are aware of a shortage of it, but that's going to be resolved. It's short term. So I think within the next 2 weeks, they should be back on shelves and fine. So if you just hold off for now, you will be able to get it. Obviously, only using Equest Pramox, which is moxidectin and praziquantel, if you also need the praziquantel for your tapeworm treatment, having done a test prior for it. So otherwise, you could use the plain green box Equest. You could still do that and then address tapeworm differently if you need to get that treatment in right now. But yeah, just hold tight, and that one should be sorted fairly soon, I think. What else have we got in here? I've treated my rising 3-year-old after her blood test showed medium-high results. She also had a tapeworm test and poo count. Should I do another poo count? I saw some dead small redworm coming out in her.
When did she treat?
Doesn't say. She treated after the blood test, so but it doesn't say any more information than that. I guess you haven't. Oh, so you will have had worm egg count results. So it would be good if you can 10 to 14 days after that treatment to do another worm egg count as a reduction test. That would give you quite a lot of information as to whether that chemical had been fully effective in the body, I think.
Yeah, I would agree with that. Yeah.
Great. Lucy is asking, what do you do if you have wormed but the worm count rises? Mine has risen even with moxidectin. I suppose the thing really is to, there's so much kind of missing in that, whether there's reinfection, whether there's resistance, did the horse receive the right dose for the weight of everything? So those are all the different questions that are going around in my head, and I think probably you're best to drop us a DM or some more information, and we can start to try and unpick that for you, Lucy.
Absolutely. Yeah, it's good. It'll be, the critical thing will be to know the timing of the different worm counts.
Yeah.
And the practices around the application of the anthelmintic, just to check that it got the full dose for that one. Yeah.
Yeah. Katie's saying, our horses live out. Is it enough to swap their fields for 24 hours after worming? Well, that's a big one, isn't it? Now being advised for refugia not to worm and move. So we want this balance of resistant and susceptible worms. And so we're saying once you're given a treatment, not to move straight onto fresh pasture, but if you can, to put them back out on the same pasture for at least a week so that they get this representative population back of worms.
Yeah. Absolutely. Yeah, I think just move them 24 hours won't really have any impact at all. You just keep swapping them. So, I mean, so obviously there's the impact of refugia. And I think you're right, Claire, that actually you don't want to put them onto a fresh field because then you'll only seed that field with worms that have survived the treatment. So that's not a good idea. You're better putting them back onto, if it's a contaminated field, where there's been no dung removal, then any worms that survive treatment and are released, eggs are released in feces, they'll be diluted by the worms that are already on that paddock that haven't been under a selection. So yeah, I wouldn't recommend the 24 swapping field thing. The other thing is to consider the drugs that might be in the poo, so environmental purposes. So I guess if you're near a watercourse or something like that, particularly if you've given a macrocyclic lactone, especially ivermectin or moxidectin, then actually there might be validity in actually, if possible, stabling them for a day and then not turning them out.
Yeah, and really looking at peak excretion time of that as well. So it's between 24 and 48 hours, really, isn't it? If you're stabling for any time, if you can do that, and poo picking if you're not because of the egg shedding.
Yeah,
really good. We've got a question here about defining low and high stocking density. So for that one, we can go back to our canter risk assessment, which is similar parameters to the what's your worm risk that we talked about. Really, we're looking at low stocking density being more than 2 acres per horse, a medium of sort of 1 to 2 acres per horse, and a high stocking density of being less than an acre. So that's the parameters that we're defining on that one. Mia's asking, is it important when the horse has been tested and treated to then do another test? Oh, we've talked about that one, haven't we, about reduction testing? But I think Lau is asking about reduction testing generally, just some parameters around those. Do you want to talk about that, Jackie?
What's that about?
About reduction testing.
Reduction testing, yeah. So reduction testing is what you do is obviously you have to do a fecal egg count first. Ideally, it's a screening egg count, and if you can treat quite quickly after your screening egg count, you don't have to do like a day of treatment egg count. So you would go in and you would treat all horses at 200 eggs per gram and above, and then 2 weeks later, you would take the samples from those treated horses under exactly the same way, submit them to the lab, and then what you then need to do is get the counts back. You or the lab or your vet would work out the percentage reduction in egg counts between your treatment fecal egg count and your 14-day after treatment fecal egg count. And what you're looking is to reduce the mean eggs in the group per gram by over 95% if they've received a moxidectin or an ivermectin wormer, and over 90% if they've received a pyrantel or a fenbendazole wormer. I generally advise people to do fecal egg count reduction testing or efficacy testing in the summertime, because that's when we're more likely to see more horses that are positive with egg counts and higher levels with egg counts, because the more horses that you can put into the fecal egg count reduction test, the more robust the data is, because the test is affected by the fact that quite often, particularly in well-managed groups, only a few horses will excrete enough eggs to be treated and then to be tested. So you want to try and apply the test when you're more likely to pick up egg positive horses that are over 200 eggs per gram.
Yeah, it's an interesting one, Jackie. Yeah, because in our test result data, we actually see high egg shedding right through the winter, but these things are always moving, aren't they? And it'd be really good to unpick that with you at some point.
Yeah, absolutely. I mean, epidemiologically, if you look at it, the egg counts will more likely be higher. It'd be interesting to look at populations, although we've seen this sort of general trend and it's a different year, is to look at the actual individual group level, what proportions of horses are actually over the egg count. But it's something to monitor, and I think with the change in climate that we're getting, we might be seeing these impacts and changes in egg shedding across the year. It's really important to leave enough time after treatment before you do your next egg count. I've come across quite a few people that egg count quite quickly, and then it's not giving egg counts time to go back up to make an informed decision. So if you're given something like a macrocyclic lactone, like ivermectin or moxidectin, we recommend you wait at least 10 to 12 weeks until you do your next egg count. And hopefully, if you have got sufficiently high, hopefully they'll all be negative and you don't have to treat, but if you have got a sufficiently high number of horses with over 200 eggs per gram, then a fecal egg count reduction test can be applicable.
That's grand. Lau is asking, I hope I pronounced your name right. I've always been told to wait for the first frost to worm with Pramox, and there's a couple of other things, questions around that as well. And I think that's getting mixed up with the botfly advice, isn't it?
Yeah, absolutely. I get asked this almost every time I talk to people about worm control, and this first frost. I'm actually going to get a mug that says the first frost thing with small red worm treatments is a load of poo, and just hold the mug up. So everybody, please don't wait for this first frost. And there's lots of reasons. First of all, as I mentioned in my slides, remember that horses become infected, particularly over the summer months, on contaminated grazing with larvae. And the more contaminated that grazing is and the more susceptible the horse is, if it's a youngster, for example, then the more likely it's to accumulate encysted larvae. And these accumulations are really occurring all year in and out the horse's gut. But the way that we manage our horses, and because larval development is faster in summer because it's warmer and it's moist, then the peak numbers of third stage larvae on paddocks in the UK tend to come around sort of July, August, September time, and that's when horses might accumulate lots of worms. And for youngsters, they develop these big mucosal burdens. So what you need to do to make your decision about larvicidal treatments or testing is to do a risk assessment. And if that risk assessment is telling you that your animal is likely to have a high larval burden or a group of horses, then you want to be thinking about giving that larvicidal treatment to kill those larvae any time from October onwards, depending on how you graze them. In fact, there's someone on the questions I was just reading a minute ago said their horse had colitis, but they were still waiting for the first frost or something like that. The fact, if your horse has got a parasite-associated colitis, that is telling you that horse had a damaging burden that was accumulated last summer. So please don't get mixed up with the first frost. So if you do treat a horse, then what happens usually in autumn, winter, or early spring, hopefully most of the parasites are killed. If any parasites are released after treatment, then the eggs will still persist in the pasture, and they will persist over the winter, and they will hatch when it gets warmer and the larvae will develop. And also on paddocks that are already contaminated, those third stage larvae don't go away. They actually stay there. So if you had a big burden on your paddock in August or September, for example, even if the horses go in or they continue to graze that paddock, many of those larvae will persist till the following year because they have this protective coat around them, which is the cuticle of the L2. It's like called a sheath, and that coat protects those larvae through the British winter. And what would then happen is those larvae, particularly if the field is free of horses, then the larval contamination reduces as the year warms up because those larvae can't feed; they're trapped within this coat. and they basically run out of food reserves. So by the middle of the next summer, most of those larvae are dead. So really, when you're thinking about insisted larval treatment, you've just got to really think of risk and not think too much about frosts and temperature and stuff, especially now, because Claire and I were talking about this on Monday. We had -3 or 5 last week, and we've got 10 degrees this week. So in the British climate, you can't even actually base anything on the temperature and weather. Think about the epidemiology of the infection. Think about eggs going onto paddocks. If you don't lift dung, then you're going to contaminate the paddocks. These are going to develop to third stage larvae, which are going to migrate out of the poo for at least, maybe 20, 30 centimetres. They're going to get onto your paddock, and those L3 are going to hang around till they're eaten by a horse, build up in the mucosa, or they're going to hang around till next year.
Great. I think it's really important. Do our poo picking and do your risk assessment. Talk to your prescriber. It's probably where to go with that one. Yeah. Suzanne is saying vets are using different levels for recommendation to worms. So their vet uses 400 eggs per gram rather than 200. Why would this be? And I think it's really we use 200 eggs per gram because it's the trust is in research. Modern research. Liverpool, Glasgow, all have done research and have set this level. What we don't have yet is any research in terms of if we increase that, what that has in terms of disease impact or pathology or anything like that in the horses. So some vets are suggesting that. It's not something currently as an SQP, as a prescriber, that we are comfortable with doing, but I think we're going to see research hopefully come in the future that's going to help to underline that and to understand that if we do move that, say for healthy adults, what impact that's going to have in terms of the numbers of wormer treatments that we can save, and therefore the impact that that will have on resistance. And I think that's one of the core things really for us moving forward, to be able to really look at that carefully. And certainly places, charities and other areas where they've got vets on site and they're so closely monitored, they are able to do that. And that's perhaps where our research should start on that one.
Absolutely. I think there's so many unknowns. And we were involved, people in the early 90s developed that threshold of 200 eggs per gram, not really based on any science, but that's what we've used for many years. And it doesn't seem to have had a hugely negative impact on the development of clinical disease. What we don't know is if we start to change that and increase that, what impact that will have, particularly where there is poor management and contamination, and particularly in situations like we had this year where we had a very warm and moist summer and these larval levels can develop very quickly. So I would certainly stick to the 200 just now. If you had one horse or a couple of horses and they were on 20 acres, then you could increase that threshold. There could be some, rationale behind that. But I think you really have to look at all these different parameters that you can find on Watch Your Worm Risk, for example, stocking density, age of animals, before you make any decisions to change that threshold.
Fantastic. Yeah, Vicky is asking, what do you do if resistance is proven after worm resistance testing? That's a whole can of worms, isn't it?
Literally. Well, it depends on the wormer that the parasites were resistant to and what parasites were there. So there's two main things you can do. The first thing is really to get on top of the management. So you really don't need to be treating too much. So trying to get dung removal done as frequently as possible, ideally daily. So you're cutting down that challenge so that when people go in to test your horses, they'll be fecal egg count negative, or they'll be low in a tapeworm test, or they'll be low in a small red worm blood test. So that's the first thing. If you find then, particularly if you're grazing historically contaminated paddocks, then what you need to do, and I would advise people probably to work with their vet if resistance has been detected, because that's going to be perhaps a clinical issue, particularly if it's a large group of horses and they're youngsters. Then what you have to do is then have to systematically work through the different types of wormers that are available, depending on the class to which resistance was detected. And I've done that. I've worked with this on stud farms in the UK and in the donkey sanctuary. And it doesn't mean that there's resistance to one, that there's resistance to all, particularly if they're in different class types. For example, macrocyclic lactones versus pyrantel or versus fenbendazole, if you're looking at ascarids and foals, for example.
That's brilliant. I'm just scanning through. Have you seen any more questions that we can pick off quickly before we close up?
No, I'm going through all the frosty ones. I'm just having How long does it
There's a
take?
little confusion there about Equest and Equest Pramox. Someone thinking that Pramox is just for tapeworm. Now, Pramox is actually a 2-chemical wormer. So we've got moxidectin, which is the larvicidal, which specifically targets small redworm and a large redworm if there's any present. And then the praziquantel is the tapeworm only element of it. So 2 together there. So you can, if you just need to use the larvicidal, then a plain green box Equest is the moxidectin on its own version rather than the Pramox.
There's one thing we haven't covered, which we can do quickly, Claire, is quarantine. Because Selena, she asked, what would you do if you moved to a new property with your horses regarding grazing, if you don't have access to the history of pastures of horses? So of course, that's a good way to look at it. So you can look at it both ways. So if we do the simple one first, and you've got new horses coming into your yard, particularly if you're low risk, what do you do about those horses? Well, your option is just to take the most broad spectrum anthelmintic wormer and treat the horses for that, particularly if they are a high risk horse. So you think, well, they've come from a high risk situation, so I need to use a wormer that targets as many small redworm stages as possible, and tapeworm and other worms such as large strongyles. So that would be Pramox. What you could do is also take a much more scientific approach to those horses, and you could do an egg count when they arrive. And you could also do a tapeworm saliva test. And so that would tell you whether they're shedding eggs. It would contaminate paddocks. It would also tell you whether or not they tapeworm. It's important to remember to check when their last treatment was. If you're using an antibody test, you want at least 3 months before you do the saliva test. And then if you're really super scientific, you could actually just do the tapeworm test and the small redworm test, and that would tell you, and you can actually combine them both as a blood test, and that would tell you about the stages of small redworm that you wouldn't detect by an egg count. So that would be your options. Now, for a situation where you're moving your horses, Selena, to a property that if you don't have access to the history of the pastures of the horses, I think you should really try and ask as much as you can and try and find out by detective work what's going on. It's very difficult. We could go around and pick up unremitted mites and we could PCR test them, but that would not be a financially viable thing to do. And it's very hard to do larval recovery from paddocks because the long tails of cyathosomes bind to the grass and it's hard to pull them off. So what you would do is I would really start monitoring as soon as you can when they're on there. So you bring them in, and obviously be monitoring them clinically, and then depending on when you did your last egg count, I would start developing egg counts. So if they picked up worms, for example, it's very contaminated, they might actually start excreting eggs in as early as 6 weeks, but it could take a lot longer than that if the mucosal stages develop. So you could actually do a small redworm test, and you could look at to see if they have been exposed. In an ideal world, you would do that when you put them there, and then when you maybe like 2 months later to see if they've been exposed. Likewise, you could do a tapeworm saliva test. I wouldn't do it immediately when you're there. You probably, if you are going to test them to see if they have been exposed, I haven't been asked this question before, so well done. I would wait at least 2 months before you do any testing, and then just fingers crossed that all those tests will be low. And obviously you're going to institute good management yourself, so you're not going to contaminate that paddock anyway by doing regular dung removal.
Fabulous. Danielle saying, a large livery yard near us is advising that blanket worming is mandatory due to them having a redworm burden for years. Surely this can't be right. Yeah. They're definitely going to have one if they carry on regular worming, for sure.
I know, you need to convince those people to start thinking sustainably and say, well, actually, if we just keep giving blanket treatments, they might stop working. And then if there is a burden there, then the horses that get really sick, there won't be a wormer left to treat them to make them better. So it's really important, if you can, send them this link so they can hear us going on and on about small redworm and large redworm, but mostly about management. And there's lots of information. I've written a chapter in Canter all about the underlying principles of why we should institute good paddock hygiene and good other management practices and good quarantine on yards, because we can really drive down infections by just doing simple things like dung removal and no harrowing. In fact, I didn't show the slides because I didn't have time tonight. We're doing this, I showed some of the slides, but we're doing this study down in Kent, and there's actually a yard that actually has 2 groups of horses. And one group of horses are managed without dung removal and harrowing, and another group of horses on that yard are managed with dung removal and no harrowing. And even in those small groups, we found significant differences in their egg counts and their small redworm test results, even within the one controlled yard. They were in different paddocks and they were managed differently. And I think that was the best example to give people the value of dung removal, because even in horses managed by the same people, they just do different management because of the groups of horses they actually could drive down their treatments based on testing by applying good paddock hygiene.
Yeah, it's so key. We didn't really have time to get into it, did we? But actually management, like all the way, is just so effective at this without having to rely on the chemicals. Yeah, and on that note, Sheila's asking, does co-grazing with sheep significantly reduce the risk to horses, or is that a myth? Absolutely.
No. Not a myth, Sheila, that's not it. So actually, I mean, so a really nice study was done. Well, it wasn't really nice because they necropsied the horses, but by a guy called Martin Eisker in the Netherlands about, probably now about 20 years ago. And what he did is he took groups of ponies and he actually split them into two groups over 3 years. It was 3 different lots of ponies. One lot of ponies stayed on permanent pony paddocks, and another lot of ponies stayed on a pony paddock until July, and then they went onto this paddock that had been previously grazed by sheep. And then after each year, he necropsied. The ponies were slaughtered, and they actually did the worm counts in them to get the data to understand the value of, in this case, it was alternate grazing. And when you look at the worm counts of those ponies that graze the sheep paddocks compared to the ponies that graze the permanent pony paddocks, the level of reduction in worms on the sheep grazed ponies was huge. It was massive, actually. I quite often show that data, and that was very good evidence about the value of using sheep. Now, you could co-graze them at the same time. That is a possibility. So the sheep will hoover up some of the small redworms and other parasites that are there. But the best way to do it was the way that Martin did it in his study. Martin Eisker did it, was actually he kept the fields for the sheep for the first half of the year, and then he swapped them halfway around. So that not only had the impact of the horse redworms dying out from one year to the next because of the increase in temperature as the year progressed, but also the sheep acted as little biological hoovers and were grazing up the redworms and other horseworms that were on those paddocks from the previous year. So that is definitely not, unlike the frost myth, the sheep myth is not a myth.
Biological hoovers, I love that. Never look at a sheep the same way again, will we?
We should call them biological vacuum cleaners, so we're not like on with a brand or biological Dysons or something like that. Vacuum cleaners.
Oh, fabulous. Rachel's got an interesting question. She's advised that if you worm a horse with a non-moxidectin, so like an ivermectin, that has encysted redworm, that could promote a mass emergence. Is that true?
There is some evidence in the published literature that one of the risk factors for the development of larval cyathistominosis in horses is a recent treatment with an adulticidal wormer. Now, an adulticidal wormer would be wormers that we know from the efficacy data from the products we're licensed that they don't kill a large amount of the encysted stages, particularly the early L3, which are these tiny little worms. So the theory would be that actually if you had a horse with a sizable encysted burden and you went in with an adulticidal wormer such as ivermectin or a single dose of fenbendazole, probably wouldn't work anyway, or Parentel, what you do is you clear out all those adults and luminal stages. And what we think is there's either a negative feedback mechanisms which the worms in the mucosa, the encysted larvae go, oh wait a minute, the lumen's empty, and they start to emerge en masse together. Probably that theory is more substantiated if actually you think that the worms in the lumen, the adults and the other larval stages that are in the lumen, they actually are stimulating an immune response as they feed on the plugs and things. And then when you kill all those worms and some of the later mucosal stages, you're reducing that antigen stimulation, that you're reducing that immune stimulation, and the immunity comes less in check for the encysted stages, and then they start their redevelopment, and then they can come out en masse. So I would say to people, if you've assessed a horse that has a high risk of having a large mucosal burden, I'd be very cautious about giving it an anthelmintic that doesn't have a larvicidal activity.
Fantastic. There's quite a few comments here just reiterating the management and the benefits of doing that, the impact they've seen on their own horses' test results from poo picking daily, from resting, rotating, that sort of thing. So that's brilliant that we're seeing that in action. Katie is asking, if you are on a high-risk yard and worm once a year with Pramox or a quest based on saliva test and worm count the rest of the year, should you then switch wormer the year after if you have to treat, so not Pramox, and use the other one, or so fenbendazole, or can you use Pramox again if needed?
Well, that is, so it's a high risk yard, yeah.
So yes.
Yeah, so you could probably get away with an annual Pramox. If you were going to use fenbendazole, what you need to do probably to speak to your vet or prescriber and say, well, actually, what's the historic use of fenbendazole in that yard, and is there a likelihood of resistance? And if you were to try it 1 year, what I would definitely do was to be recommend to do a day of treatment egg count and an egg count 14 days after that first day of treatment with the 5-day guard. I think because that's a big effort, people don't do that. So they either give the Fendent over 5 days and hope for the best, or they just give the Pramox or the Equest. But it is worthwhile. And if you're doing egg counts in the summer and you're thinking about going forward and you're thinking about using fenbendazole as a larvicidal anthelmintic, you could try a fenbendazole dose in the summer and to see if that has efficacy. And if it does, then there may be value in doing a panicure guard, a 5-day treatment as a larvicidal dose, if you have a proven efficacy of over 90% fecal egg count reduction. So yeah, that's a difficult one. I think people just tend to reach for the Equest or the Pramox. But we might be in that situation with moxidectin in a couple of years where it stopped working, and then we don't have any other solutions. So all the time people try not to say, I'm in a high risk yard, I've got to do this. Think about, I'm in a high risk yard, how can I reduce that risk?
Nicely said. Yeah, Alison says, I've done a worm egg count for all the horses on my yard a few weeks ago. The results were under 125. In the spring, I'll be moving them to new fields. Please can you advise which tests you would suggest prior to turning them out in the new field, which has been rested since July? Okay, well, I mean, if it's so you said in 3 months' time, it would definitely be worth doing a fecal egg count at that stage to see what you're going to carry onto that new field and make sure the horses are treated at least a week before the move. So I would do that. I would also do a Equisal test at that stage as well, just to make sure you aren't putting any tapeworm, because tapeworm can be a real devil to get rid of once it gets into the orbited mite population. So I would also do an Equisal test. So maybe about so you're going to move them in 3 months. So maybe about 1 to 2 weeks before, maybe 2 weeks before you move them, is fecal egg count everybody and Equisal everybody, and then treat those that need treated the week before you move, and then move them. Fabulous. Katie is asking, why does harrowing work if dung has larvae? I think there's maybe a little typo in there. What we're saying is please don't harrow, because really you're just doing the worm work for them. So usually in grazing, we have these latrine areas like where the horse is dung, and then the lawns where they graze. And if we're harrowing, we're just spreading all of the dung across the field, which means that any larvae that are hatching are just having to wriggle a very short distance away to the grass that the horses are actually grazing, and it just means that they're much more susceptible to infection. So we'd really just in our climate not recommend that as a way forward for parasite control, unfortunately. Absolutely. Sadly, it's just not dry. People used to say, well, harrowing was developed in where it's hot and dry, and the larvae would desiccate when you spread them around the field and expose them to the sun. But sadly, our weather isn't dry enough for long enough and hot enough to kill the larvae. They're pretty robust little things. I mean, I've worked with cyathistomans for a very long time, as I've already said, and I've done all sorts of nasty things to them. I put them in PCR machines where you heat them up to 95 degrees and then 72 degrees over 40 cycles, and some of them are still there. I think when I go to the pearly gates, there's going to be a whole load of worms waiting for me to get their revenge. No, but it's support, Jackie. But I mean, they have dug them up from like 10,000 years ago under ice, haven't they? And they've still been like come to life. So they're absolutely incredible beings. I think, you know, they need some applause and some recognition for just how hardy they are. Absolutely. Yeah, which is why they're so difficult to control, really, because the evolution has just made them that way. It's incredible.
And the thing is, they've evolved with millions and millions of years with horses. But remember, horses only really get clinical disease of worms because it's our doing. Because in horses in the wild, they graze and they poo and they move on. They graze and they poo and they move on. They don't keep eating in their own toilet. And when you put horses in a field, particularly at high stocking density, if we don't do dung removal, that's basically what we're doing. We're asking them to obtain their food and their feeding from basically their toilet. So is it any surprise they develop large parasitic burdens?
Absolutely. We've got a question from Fiona who's saying, I notice a hardened crest when worming with a quest. The pony has EMS. Is this common? Why would that happen?
The pony has EMS when it's wormed?
The pony has a well-managed EMS, but it had a worm, like a hardened crest reaction to it. I guess that's a systemic thing, isn't it, to the chemical?
Reaction. Yeah. I mean, it's not common. So I sat in the veterinary products committee for 11 years, and we see all the reports that come in, and you don't really see that many reports of horses to wormers. Moxidectin is the one that's probably got the most potential to have an adverse effect because the dose for toxicity is relatively low compared to some of the other wormers. So like a double dose of moxidectin in a young foal, for example, could cause it to collapse. So it is a rare event. If it does occur, do report it to your vet, so they'll make a note that wouldn't prescribe or use that wormer again, and they would probably report that back to the marketing authorization holder, in that case the WETIS, who would then have to make a report to the veterinary medicines committee, the directorate, and they monitor. So if there was an increase in any adverse reactions that were reported percentage-wise across the population, they would flag that up, and something would be done about it. But it is a pretty rare event, and it's just an unfortunate event, I think, in your case.
Yeah, and I think there's so many more benefits to using them that, there are going to be side effects from some medications, and but it's all balance, isn't it, really?
Yeah.
Selena's just saying, is it okay to harrow for the soil management if you do poo pick or hoover and your horses are generally low counts? I guess some people do to get the thatch up, don't they, to help the grass come through, and I guess in that case you're not having the adverse effect, so yeah, I don't see a problem with that.
Yeah, there's an evidence basis there, isn't there? So you're pretty sure that there isn't contamination on the paddock, so there could be other benefits then of spreading the manure.
Brilliant. Right, well, we've come to 8:30, and kept you good people so long talking about worms on your Wednesday evening. So I think we're going to have to wrap it up there. But if you have further questions, please do ask them in the comments, and we'll get in there as soon as we can and answer any others that we might have missed. If you have specific questions, then please do get in touch, send us a DM, or you can ring or email, and we'll be really happy to help you with that one. Don't forget that we've got a discount code running till end of play, like midnight tonight, if you do need your worm count tests and things in. And I think all that's left is to say thank you so much for joining us, and what a joy it's been to benefit from Jackie's amazing knowledge of parasites and redworm and all the papers and research and things you've been involved in. So it's absolutely fascinating, and to get all of that insight. So lucky to have you, and thanks for joining us, everybody. It's been wonderful, but please reach out if we can help any further, and get your testing in, I think, is the key takeaway from tonight, isn't it?
Yep, and your good management. Yeah, thanks, Claire. And the brilliant questions, guys. It's a really, really great community. So thanks for joining us tonight.
Super. Thank you now. Cheers. Bye.
Bye.